Hello, students. So today I'm going to show you something interesting. I know you have gone through the recordings of learning the EMR and so forth, and of course we will keep teaching you about EMR. You should learn that. And don't forget to look at the ring binder in which we have examples of history physicals and that have been documented in the past. And you can just see the layout of there, and then it could give you an idea about. There are three categories of notes that we take. One is a new patient, as a cardiovascular consultation, and of course focus on cardiovascular, and of course add on internal medicine or whatever the findings are. So that's the new patient history and physical. The another patient was a disability patient that is more extensive in internal medicine history. Sometimes they are cardiac too, but a lot of times they're just musculoskeletal. And so that history has to be documented. Third is the follow-up note, which is you can base it on the previous note of the patient, but sometimes when they come back for the first visit after having seen me once, then don't take the new patient note. You have to start with the follow-up note template. And of course, we'll guide you on that. Now, the reason I'm making this presentation, and I've been teaching this off and on, but today I thought I'll put it all in video form so that it's documented and all the new students that are coming can look at it. So here we go. So since you are not, most of the time, we cannot allow you to put your hands on the patient, except if you are a student in a medical school, then we are allowed to let you put your hands. The other doctors and residents are supposed to just observe. But even in observation, if you see me examining, that's enough for you. And you learn basically by watching and so forth. But there are a lot of things that you, without putting your hands on the patient, what do you observe that you can put in the physical exam? So let me tell you today what are the things that you can see in a patient without touching the patient, and yet they become part of your physical exam, objective exam. So here is a patient who is sitting in the chair. We have always a new patient, we always ask them to take their shoes and socks off. It is very important. Otherwise, how are you going to look at the feet? So he has shoes and socks off. And of course, sometimes we take them to take their shirt off and all that, but he's fully clothed and so forth. Because in unlike surgery and all that, we are not really examining specific areas of the body and so forth. So look at the patient. Now, I always start from the head and go down so that you don't forget anything. So look at the head. What does the head look like? The head is, of course, atraumatic. There's no evidence of injury. He has dark hair on his head, and he doesn't have any baldness. Sometimes when there is receding hairline, that's called the male pattern baldness. He doesn't have that. And is So that's the examination of the hair and the head, just looking without touching him. The forehead is without wrinkles. It doesn't seem to have any ptosis of the eyelids. He doesn't have any asymmetry. He doesn't have any squint um, of the eyes. His ears look to be in reasonable shape. There's no lesions on the nose. For example, rhinophyma, in which the nose gets enlarged uh, because of conditions. There is no butterfly rash to indicate lupus. His color looks okay. His color is pink. There's little chance that he's anemic. Um, so that's the examination of the head. His neck, there's no swelling. If you can also watch and look and see if he has any thyroid enlargement. This is visible as swelling. He doesn't have torticollis, or maybe he's tilting his head, but you can when the patient is in motion, you can see if there is any torticollis or any deviation of the neck. His shoulders seem to be symmetrical. And they was in place. Of course, if he was not wearing the shirt, you will be able to tell if there's any dislocation of the shoulder. Chest, if he is unclothed, and you can look at the chest, you can see if there is any pigeon chest, any excavation of the sternum. You can watch that. Here we can't see it. Abdomen seems to be flat. He's not protuberant. He's not obese. So you can note that. And generally also you can note that he's not obese man. He looks to be average BMI. Um, Arms seem to be okay. Now look at the tattoos on his hands. So that has to be remarked always, that he has tattoos on both the hands. His knees seem to be okay. They're flexed, so he has good flexion of the knees, good flexion of the ankles, good flexion of the wrist joint. Um, Looking at his legs, they seem to be in good shape. You can't tell if he has good pulses, but you can tell if he has gangrene or color changes in his legs, which doesn't seem to be the case. So to that extent, you have examined the patient just by glancing at him. Now, if you were to stand, you will be able to see his station, how he's standing, tilted or, in one way. And then if he walks, you can tell how he walks. Does he have a limp? Is he walking with a shuffling gait? Does he have Parkinsonism? So those things you can watch. Now, of course, I forgot to tell you, in the hands, you can also watch and see if he has any tremor. So if this patient is a real video of this patient would show how his movements of his hands are and if he has any tremor. So you would note that too. So that basically shows you that there are things you can see on the patient, will tell you that what he is, and then keep watching the patient. He stands up, and if I make him do other motions like shrugging his shoulders to test for the accessory nerve, sticking out his tongue, or even watching the movements of his eyeballs for cranial nerves, uh, and watch if I make him bend down and touch his toes to see how his back is. Yeah, I can tell them to also rotate his back. I can tell them to walk on tiptoes, walk on heels, walk tandem one foot after another, and I can tell them to squat and get up. And all these are part of disability evaluation exams that you should be watching and documenting. So further, if I notice anything else, I will make another video. For now, just watch this video to just learn how to examine the patient without putting your hands on the patient. Of course, it's limited, but I will tell you the findings in auscultation of the heart or palpation of the abdomen. We can tell you that. And you will be watching, of course, the movement of the joints, the flexion of the elbows, flexion, extension of the shoulder joint, the abduction of the shoulder, movements of the knee joint, movement of the hip joint, movement of the ankles, so forth. All these can be observed. And of course, movement of the cervical spine. So, so far, it's so much for now. And maybe in a later video, we'll show you more things. Thank you very much.